You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures, according to my first guest. He says you could walk in his office without teeth and walk out with a full arch of teeth. We're talking about dental implants today. With us, we have an expert on the topic. He's been doing this for over 30 years, Dr. Clark. Dr. Clark, welcome to the program.
Thank you for having me.
All right, now you have been doing this over 30 years.
Oh yes, long time.
I mean, you were doing implants, and we talked. You said when other dentists thought you were crazy for doing it.
Yes.
Is that right?
Yes,
and now
yes,
they're
yes.
mainstream.
Right. I was taught by the actual pioneers, people who invented the whole field, taught me personally. At the time, it wasn't taught in schools, and you actually had to mentor under someone.
Why'd you like it so much, by the way?
Because it changes everything. It changes lives, it changes relationships, and it's so immediately impactful.
What do you mean by that, by the way?
I mean,
it could
because-
change their life.
Oh, listen, people come to me because they are ashamed of the smile, because they can't eat certain foods.
Okay.
And one time, because the husband did not know after being married for 30-some years that his wife had a denture.
Is that right?
She was very religious. And she just didn't want to tell any more lies. She asked me,
Interesting.
she said, if I get dental implants, will my husband have to know? And I told her, well, not unless he asks, I just can't lie about it. So she came in, she got the dental implants, we put the teeth in right away, and she came back for her checkup, and she just sat in the chair and cried. She said, I should have done this 20 years ago. And that was so rewarding to me because I changed her life. She didn't have to live that lie anymore.
Interesting.
She was saying how she had to go to the bathroom all the time to remove her dentures, how she had
to clean them or whatever?
to clean them. And before she went to bed at night, she had to make sure there was enough glue in them to stay in for the next day. She said it was just important for her to not have to live a lie.
So for people that don't know you, though, I mean, who's your typical patient? I mean, do you only do dental implants?
No, we have
Okay.
a thriving general practice. We do a lot of dental implants. The majority of my practice is dental implantology.
Okay.
But my typical patient are patients who walk in with missing teeth, 1, 2, 10, 15, 20 missing teeth. It doesn't matter. Any void in the mouth is what we're looking for to help restore them, to make them whole again.
Okay. Now, we said at the top of the show, no more dentures, like no more traditional dentures. You
absolutely.
believe that?
Oh, I know. We don't have dentures in our office. Dentures in my office are only transitional to get permanent teeth. People don't come to me for removable teeth. They come to me to get permanent teeth.
So the word on the street is you're the guy that
puts permanent teeth in. We don't have people taking out teeth and putting them in the morning. That's long gone. It's been gone since the 70s.
Is that right? So what's changed over the years? I mean, I guess in the old days or even today, 6 to 9 months to get this done, and in your office sometimes could
Right.
happen just a couple of visits.
Just a couple of visits.
So why is it so fast today?
Well, the materials have changed. The imaging systems have changed. We are able to do 3D analysis of patients so we can have guided surgery much faster, much more predictable.
Okay, now, the way it's normally done, and correct me if I'm wrong, you go to one person that does the imaging, like one office,
Right.
in some cases, and then you go to the surgeon for the implant placement, and then another dentist will put the crown on top.
Right.
You do all
Everything
that
is
there.
in one office.
Okay.
We do the imaging, we do the surgery, and we put the crowns on top.
Okay. What
So-
are your credentials when it comes to this? I mean, your official training. I know you've been
Well-
doing it for 30 plus years.
Well, I'm an implantologist. I'm a member of the American Academy of Implant Dentistry. I'm a fellow. We can't go any higher than that. My credentials are the highest you can have.
Okay, so it's not a recognized specialty in dentistry.
Right.
But you've taken these courses.
Yes.
Okay.
And it represents over 2,000 continuing education hours. So, we feel very, very confident that we can handle almost any problem that you may have when it comes to restoring your teeth.
Okay, good. And the nice thing is you say that you're changing people's lives. You said to me in the green room, at the beginning, you have these team meetings,
Yes.
huddles,
Yeah.
and you say at the end of the meeting,
The last thing we say, the office manager says before she dismisses the morning huddle, is the thing she asks is, whose life will we change today? So we have to pick someone on the schedule that day that we're going to make a dramatic change in their life that day. And it gives everybody incentive to stop and ask questions to that patient, to give that patient an extra hug, to let them know that the whole staff is committed to making a life-changing experience for that patient that day.
okay, now in regard to dentures,
Yeah.
is it a big problem? I mean, are there a lot of people, like within an hour of your practice, would you say tens of thousands of people, upper, lower denture?
Yes. And the problem is, Randy, as I see it, is that people know there's something out there, they just don't know what it is, that they can make their lives better. The mouth is the portal to the soul.
Okay.
And we know that in the first 45 seconds of meeting someone, you've made your mind up, and the only part of the face that really changes over a 30-year or 40-year time is the lower third of the face. That's where the mouth is.
Okay.
The first thing you do when you go to Hollywood, the first thing you do when you go to Broadway is not fix your eyebrows, it's not to fix your hair, it's to fix your teeth.
The agents,
Yeah,
I think you told me.
The first thing the agent will tell you, let's fix your smile.
Okay.
Let's make your teeth look good, because we know that's going to affect everything. Your acceptance, it helps you get better jobs. It helps you in the courtroom. It helps you in your social interaction. It changes your life. I can't tell you how happy I am to be a dentist, and I have remained this way ever since I got out of dental school. It's something that I look forward to every day.
Very good. But you know, we were talking. I said, what made you want to be a dentist? And you said you were going to medical school, or you wanted to go to medical school. You went to Howard University, but you said that there was a lecture by a dentist,
Yeah,
and he said something
yeah.
that
This
sparked.
we were in a medical school meeting, and they asked this dentist to come in, and I never considered being a dentist, but he said something at the end of his lecture that made me think about it. He said that of the three professions, law, medicine, and dentistry, he said, when you go to the dentist, something positive happens every time. You get better every time.
Okay.
It's not like that in medicine. It's not like that in law. But in dentistry, we improve somebody's life every day. Every day. So I thought, that's the kind of profession I want to be in.
Is that right?
I'm going to help somebody every day. That's why I love the profession so much.
You said people, when it's all done, okay, you take a denture wearer,
Yeah.
you give them a fixed set of teeth, a full arch of teeth with like just about 5 implants,
Yeah.
full arch of teeth, that they break down sometimes and cry.
Yeah. Oh.
Is that right?
Oh, no. Let me tell you this story.
Okay.
I treat a lot of dentists. I treat a lot of dentist wives because I've been doing implants so long, and I consider it a badge of honor that they would trust me with their own problems. But I had one dentist who came to me. He wanted to upgrade his practice. He wanted to do cosmetic dentistry, but he always felt a little ill at ease about talking to his patient about cosmetic dentistry because his mouth didn't look that good. So when I told him that we needed to put implants in and so forth, and he didn't buy into it. He allowed me to do it. And once we finished the case, he turned to me, got choked up, and a tear ran down his cheek.
Wait, looked in the mirror and saw?
Yes, he did. And I felt a little awkward. He felt a little awkward, but that was a man crying in front of me. This was a dentist who cried. That's never happened before. I hope it doesn't happen anytime soon, but that was very dramatic. And I know his life has changed.
Well, tell me this. Okay, so if there's tens of thousands of denture wearers, upper or lower denture, and with just 5 implants, they could get something that's a fixed set of teeth that doesn't come in and out. Why aren't they all doing it if it's so good?
Because they don't know. And that's one of the reasons I wanted to be on the show.
Okay.
Because they just simply don't know that there is something out there that can absolutely change their lives.
Why don't they know?
Because denture wearers don't go to the dentist anymore. It's hard to get a denture wearer to come to the dentist.
So they don't know.
They just simply don't know.
Interesting.
Because they usually stay away because of the pain they used to have, and they think that this is the end result of a lifetime of misery.
Okay.
There's one more step you can go to though, and that is implant dentistry.
Okay.
So that you now become.
But it does seem painful.
No, it's
to
not.
do this.
It's absolutely not painful. We've had patients who come in and they wonder what they're paying for. They say, "Is that it?" And you tell them, "Yes, we're finished." They get up and they say, "What am I paying for?" You're paying for my expertise, not my time. It's my expertise.
Okay.
Because
I mean, it's virtually painless,
it's virtually painless
I don't want
because
to put disclosures all over here.
first place, we don't even have doors in our office. Everything is open. So we have 7 operatories with patients in each operatory, and no one is making a sound because
so during
we
the
just don't
procedure,
have
but during the procedure, there's no
there's
pain.
there's
What about
no pain
afterwards, though? Because that's where it seems like it's going to be tough.
No, there's a little bit of swelling, but no pain.
Or very little pain,
Very
we should
little
say.
pain. We'll give him Motrin. We'll give him aspirin, but that's usually takes care of it.
Are they sedated during the procedure?
No. Most of the time, no. Some patients who are very anxious, will sedate them. But 99% of the patients can do it with local anesthesia and without any problem.
How old could you be to do this?
Well, the oldest patient that I did implants on was 97.
97. Why would a 97-year-old want to do this?
Because they're going to live to 102. Okay. And they want those last 5 years to be very, very fruitful. And they want to be comfortable. But let me tell you the story. This blind diabetic came in, and her children did not want her to have implants. And she didn't get them for 20 years. When she turned 80, she came back in. We put them in her mouth. She then came in for her post-op check.
So it's a full arch of teeth. I mean,
Full arch, upper and lower.
Okay.
She came in and said she was angry. And I said, what have I done? And she said, no, I'm angry with my children. I should have done this 20 years ago. And I thought, I
Good.
said, wow. She said, I just didn't understand that my food could taste better, that I could feel more comfortable. Now, she's a blind diabetic.
Wow.
Yeah, and so we changed her life.
So when I hear stories, knowing you're going to come in,
Yeah.
like for example, my mother, 73 years old. At 73, she was told by her medical doctor, "You're too old for dental implants; they'll probably fall out." The other thing she was told is that she lost too much bone, that because she was in dentures for 30 years.
Well, I've never seen a patient that didn't have enough bone. And every patient that has been in my office in the last 30 odd years has been able to be treated.
Is that right?
Yes, everyone. We've
And
never had
do you
to
ever
turn-
have? I think you told me this. That sometimes people are told they don't have enough bone
Right,
by another dentist.
right.
They go to you.
And they send them to me, and we're able to help them.
Okay.
I feel good about that because, these people are desperate. But, the thing is that these people now know that there's an answer. They just didn't know what dentist to go to or how to go about it.
So no more dentures. Is this the future of dentistry?
Absolutely.
They'll always
Yeah.
a denture will be fastened onto.
Fixed teeth. That's the future of our profession.
I interview guys sometimes, and they do a lot of snap in, snap out, snap on dentures, on dental implants.
Well, that's acceptable.
But you like though, because you're I wouldn't say stubborn, but you're serious about give them a fixed set of teeth.
We want you to use your toothbrush just like you did when you were 19 years old. We want you to use your toothbrush every day just like you have when you had all of your teeth. People don't want to have removable teeth so that their husbands or their wives will be able to
Or
find
dating
out.
or whatever.
Or dating. No one wants
How soon
removable
can they
teeth.
eat? Okay, so the day of the surgery, it's all done. They walk out with their teeth. How soon can they eat?
They eat immediately. They eat immediately.
Applesauce?
Yes,
What are
we tell them to go across the street on the way home, get something hard, and start eating.
Really?
Yes, we do. Because we want them to see how dramatic their lives are changed.
So 2 weeks later, they can eat?
They are still numb. They are still numb, but they're trying to eat. And I encourage that.
Did you ever hear food stories where they say, Dr. Clark, I had my first whatever,
Oh,
apple?
we hear that all the time.
Corn on the
Matter of fact, what we do is we have fruit in our office, and we'll take pictures of patients eating immediately after.
Like what kind of fruit?
Well, pears particularly.
Okay.
Because we want them to eat something hard.
So they can
Yes.
eat like broccoli.
Yes, They can eat that type of food right away.
Okay,
right away.
But 2-3 weeks later, for sure, they could have like broccoli. I mean, they could eat pretty much.
Well, you keep saying 2 or 3 weeks later. No, we're talking about 2 or 3 minutes later.
Is that right?
Yes, we're talking, the only thing that holds them back would be the numbness, which will be gone in about 2 hours.
Okay.
But we want them to go home and eat that day.
Is there such thing as a happy denture wear?
Well,
'Cause I know a few denture wearers, they never complain.
Well, you know, let me tell you, there are people, I can answer it this way. When there's a man with one leg, he can be happy. But when
Okay.
you give him 2 legs, he's even happier.
Okay.
Well, that's the same thing with denture wearers. Well, denture wearers can be happy, but then when they have implants and they have fixed teeth, they are even happier. That's what we're in business of. We're making people happier.
Now, for the sake of time, and I know you wanted to show these photos,
yeah.
you brought some photos. What are we looking at?
We're looking at a lady who came in from the Bahamas.
Okay, let's take a look.
She wanted me to help her look better. And she thought it was just a simple thing of putting some crowns in the front of her mouth or some veneers.
Yeah.
But we had to tell her, we had to open her bite by putting implants in the back, in the posterior part of her mouth. Once we did that, it opened up her face. She started looking younger. And when we finished the case and she went back to the Bahamas.
Let's take a look at this.
This is how pretty she is.
Wow.
Well, when
That's
she
a
went-
natural looking smile.
Yeah. Well, you know, a natural looking smile is something that takes a lot of work. We have formulas. We know how long the teeth should be. We know the teeth should follow the lower lip line. We know it should fill out the whole buccal corridor, which is the dark area on the left and right side of your mouth.
So when we look at her smile, what makes that a beautiful smile? Because it looks good.
It fills the whole mouth.
And her teeth, you say, follow the bottom lip.
The teeth follow the bottom lip, and we have a little bit of gum showing, just a tad of gum. And that makes the smile lifelike.
I mean, it looks very real.
Well, let me tell you what happened. When
Okay.
she went to the Bahamas, when she went back home, all her family thought that she had plastic surgery. And we kept, you know, she didn't tell them that, no, I just had my teeth veneered and implants placed. But it changed everything. She went back and they still believed that she had all this plastic surgery in the United States. She didn't. All she did was have implants and veneers.
Now, look, just by this photo, you know, because you said earlier how people make judgments, but she
Yeah.
looks sophisticated,
Oh, yeah. She
intelligent.
Oh,
I'm not
Randy,
trying to side with you, by the way.
No, I know you're not. I know you're not.
It's a
But let
real
me tell
interview.
you.
People need to know. It's a real interview. I mean, I'm just
Yeah.
asking the questions here.
Well, let me tell you. When you have a smile, it gives you added confidence.
Okay.
It gives you a feeling that you are in control of the room, that you are in control of the situation, that you can smile and talk to people without feeling like, oh my goodness, I have to hide something. People can pick that up within the first 45 seconds of meeting you. And so you've blown your job interview. You know, if you walked into a job interview with a missing front tooth, do you think you get the job?
That's a good point.
No, you will not get the job. If you told someone that you discovered a cure for cancer and you smiled and had a missing front tooth, do you think people would believe you? No, they wouldn't.
Interesting
They would
point.
not believe you because you have no credibility with your teeth not in shape.
But most of these people just don't smile.
Yes.
To hide it.
And so when they don't smile, that kills their credibility because now people want to know, what are you trying to hide? You're not smiling.
You know what
You
I
know-
like about you? I mean, you're a dentist. I mean, you really think the smile's important.
Well, listen, I've enjoyed my whole career because I get results at the end of the day.
So you
When
see so many changes. Is that where your
that we
enthusiasm
change
comes from?
people's lives every day. So my whole staff believes in that. As soon as the patient leaves, we all are saying, "Look at what we did." That's why we take so many pictures. We take pictures all the time, and we post them on our Facebook. We post them in our scrapbooks because we know that we are making a change.
So the
every
denture
day.
wearers that are watching this.
Yes.
Okay. So you're saying that you're really never too old to do it.
Never too
Doesn't
old.
matter.
Now, I have never done anyone over 103.
But you. You're 103.
Yeah, 103. That's the oldest patient that I have.
Good for you.
But I'm looking to do one of 120.
Is
I
that-
would love to do that.
So they can eat, they can chew.
Yes, yes.
But their fear, Well, if let's just suppose, would you say there's so many denture wearers where in and around where you live, you couldn't even service all of those denture wearers if they all would consider this?
No, we couldn't service them all. But at some point in the future, people will all understand that they don't have to wear dentures anymore.
No more dentures.
No more dentures. Yeah, that would be. I would love to see it in my lifetime. No more dentures.
Okay, then you brought some samples here. And
Well,
that's just what it looks like. Is that
Yeah,
right?
very simple thing. 4 implants, teeth that go on,
Let's take a look. So
and
these
teeth
are
that stay.
so these are just put on.
Yeah.
Yeah, they look. I mean, and the roof of their mouth is not covered like a denture.
Right. The roof is. You can taste your food. You can have the food textures contact your palate, and so you're eating just like you did when you were 18 or 19, and you're looking almost as cute.
So I think you told me that denture wearers don't really chew their food. They think they're chewing their food.
Yeah, they
Elaborate on that.
what they're doing, they're rubbing their food. They're rubbing their food. They chew about 15% chewing efficiency. With implants, they're up to 97% chewing efficiency.
So they could tear the food.
They
or
can
whatever.
tear the food. They can eat beef. They can eat pears and apples. And they don't have to worry about when they go to a restaurant. They can just close their eyes and point to anything on the menu.
What's the hardest thing a denture wearer? What do they tell you? I mean, the toughest thing they have to deal with as far as eating.
Well, apples.
Okay.
They can't eat fruit because when they eat fruit, it moves the denture.
Okay.
When we put in teeth that don't come out, nothing moves. That's 97% chewing efficiency. That's back to when you were 18 or 19 years old. The only difference now is maybe you have a little bit more gray hair, but your chewing efficiency is just like when you were 16, 17, 18 years old.
Okay, you brought another photo. What are we
Yes.
looking at? We have just time for one more.
Okay. Yes, here's one of my favorite patients.
Okay.
She's 94 and frisky.
Okay.
She comes into the office and says, she lives in a nursing home. She says, I'm so tired of all my friends taking out their teeth and chewing and so forth. She says, I want to have teeth that I don't have to remove.
Okay.
Can you help me? And I said, yes. And we were.
Do you get excited, by the way, when you do a consult?
Yes.
Because I guess you don't want to feel like you're selling something, but do you get excited where you have to control yourself a little bit?
Well, because I know what the end result is going to be. I know how happy she's going to be. I know that. When she came in, she lives life. I mean, she does everything. And I call her Miss Frisky because she just refuses to give in to old age. She says, I want to eat. I want to go out on dates. That's what she told me.
Okay.
And so when we were able to remove those teeth, the broken down teeth, and take care of the gum disease, we were able to put in 4 implants at the top, 4 implants at the bottom. And we were
These snap in, snap out?
No, they are
Okay.
fixed teeth. She does not want anyone to know that she has had implants or fixed teeth
Let's
in
take
her
a
mouth.
look at the after.
Yeah.
That's a young-looking 93-year-old.
Yeah,
she looks great.
but she has not been able to move her mouth and get the smile back because she still holds her top lip down because for 20 years, that's what she was doing. But as she gets more used to the fact that her smile is beautiful now, her top lip will become more relaxed.
Very
and she'll
nice.
get that big smile on her face.
How does she hear about
But look
you?
at her haircut. Look at her haircut.
That's, yeah.
Yeah, she got one of those.
Because of her teeth.
Yeah, she got a frisky haircut. She got her hair dyed, and she's 94. That's what
How
makes
did she
me.
hear-
Wait a minute. That's what makes me go to work every day. That's what makes me want to do this every day, because I change lives every day.
Very
You
nice.
can't get better than that. 94
So
years
you
old.
love what you
she
were
wants-
meant to do this.
She wants to go on a date. She wants to go out to have dinner. That's the kind of stuff I'm talking about.
And you hear this every day?
Yes,
Like
yes.
every day,
Every
every
day
week?
in our office. Yeah. That's worth getting up for every day.
Because nobody likes going to the dentist.
Well,
Right?
Well, they don't like to go to the dentist initially, but when they have to, once this is done and they come back to get their teeth cleaned twice a year only, just to get their teeth clean and to have people hug them and to say what is happening in your life, and they're able to tell their stories, then they like to come to the dentist because now we are their friends now. We become friends with them.
You have a general practice. So,
Yeah.
So I guess there's some people that they wait for a couple years before they do it.
Yeah.
do they ever say, why didn't you make me do this a long time ago?
They blame the doctor for everything. That we should have made them do this, but we can't. Only thing we can do is educate them, you know. But I have never had a patient to say to me, "I wish I had never done dental implants." Never. And I've done 14,000. I've never had one patient say, "I wish I hadn't done this."
That's a lot of dental implants.
Yes.
You do more implants probably in a month than most guys do in a year.
Well, yeah, yes, I do. Because I've been doing them so long and my reputation is there.
Is there a big learning curve?
To learn to do dental implants?
Yeah.
Oh, yes. Oh, yes. You have to go through a lot to learn.
You're that much better now than you were.
Oh, yes. Oh, yeah. Yeah. When we first started and the pioneers were teaching me, we didn't know a lot about how bone would react and everything. But now we're past all that. Now it's about changing lives now.
Good. And you have all the, we haven't even talked about it because, you have all the, you have laser technology, you have CAT scans, you have a lot of things going on as far as technology in your practice.
Yeah, but these things support the changing of lives. Dental implants are the things that change the lives.
And
These
pain-
other things support that.
Okay.
Yeah.
And pain, so don't be afraid of pain.
Absolutely not. If we had pain, we would have doors in our office. We would close the doors. But we don't have any doors. Everything is open.
Okay.
Okay?
Okay, good. We're out of time, by the way. I want to thank you so much for coming
Hey,
on
man,
the show.
listen, thank you for having me.
This will be on your website, but if they want to learn more, they can make an appointment with you.
Yeah.
Is
Listen,
there a fee for the consultation?
No, there's absolutely no fee for the consultation. They just need to say that they saw it on television and we can come in and get a free consultation.
All right. Dr. Clark, fantastic.
Listen, the pleasure was mine.
Love your enthusiasm. I'm excited about it. Thanks
The
again.
pleasure was mine.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, just visit our website at wellnesshour.com and put in Dr. Clark. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.